I'm going to run through some epidemiologic slides and also share some data around hospital bed occupancy. So this first graph shows that COVID-19 cases are continuing to increase. One point that I wanted to make during this presentation is that our epidemiologic surveillance data is always difficult to interpret around the holiday weeks because people's healthcare seeking behavior often changes. So it can be particularly hard to interpret case counts and percent positivity because we know that there were a number of people before Thanksgiving who wanted to get tested just to see, if they were infected but didn't have any symptoms. We also know that some people with mild illness may not be likely to go and get tested during a long weekend. So it can be very difficult to interpret the data around the holidays. Over the past couple days, it does seem like the number of cases that have been reported every day has remained kind of closer to around 2,000. But again, we're not really sure if that is a positive sign or if that's just a change in testing behavior over the holiday week last week. And it's really difficult to interpret, the data in this gray shaded area, which is incomplete data. So since we are not currently showing test positivity on our dashboard, I did want to show you test positivity data that is collected by our federal government. So most of the labs here in Washington that are doing testing report their data to the federal government, and this is what the data shows. You can see in the orange line that over the past week, it does look like test positivity had flattened out a little bit during the holiday week, but I just do want to emphasize that we really just don't know, what that means, given the week is just unusual in many ways. So what's really concerning to me is that we still continue to see a really sharp increase in the number of people who are being hospitalized for COVID-19 every day. You can see that this graph that graphs the number of patients admitted for COVID-19 by hospital admission date is continues to sort of increase in a very steep way. Also concerning is that we are now seeing an increase in COVID-19 deaths. If you look down in early September, you can see that, around 5 deaths were being reported per day, and this has kind of steadily climbed over time to somewhere around an average of 12 deaths being reported per day. So unfortunately, we are starting to see more deaths being reported in this third wave of illness that we're experiencing. So these next graphs come from our risk assessment dashboard, and these are very concerning to me. So this is the graph that shows COVID-19 hospital bed occupancy in the state as a whole. And you can see that the number of confirmed and suspected COVID-19 patients in our hospitals has increased dramatically since the beginning of November and continues to increase. On our dashboard, you can actually break down this statewide data into regions. So this slide shows COVID-19 hospital bed occupancy in 4 different regions of the state. You can see in King County, the number of confirmed and suspected COVID-19 patients continues to sort of rapidly increase. In Pierce County, Grays Harbor, Lewis, and Thurston, also seeing a very sustained increase. Over on the east side in Spokane, it does look like maybe over the past few days, the number of patients in the hospital has been a little bit more stable. In Southwest Washington, seeing a pretty sustained increase as well. And this is very concerning because our hospitals, have limited capacity to take care of patients. And what we're hearing from the hospitals is that many of our hospitals are canceling a lot of their non-urgent procedures now to make space and to make sure they have enough staff to take care of the increasing number of COVID patients that are coming into their hospitals. And then this last graph I wanted to show you are the number of confirmed and suspected COVID-19 patients that are in ICU beds in our hospital. You can also see that there's been a very rapid increase and a sustained increase in the number of patients hospitalized in our ICUs. So in summary, I'll just reiterate that the case counts and the percent positivity are always difficult to interpret during holiday weeks. So unfortunately, I think we need to wait for another week of data to really better understand what's happening with our case counts and our percent positivity. What we do know for sure is that our COVID-19 hospitalizations are rapidly increasing throughout the state, and that our deaths are increasing as well. And the number of confirmed and suspected COVID-19 patients in our hospitals and in our ICUs are increasing rapidly. The number of COVID patients in our ICUs has doubled during the past 3 weeks. And if we do not reverse this trend, hospitals will need to postpone more of these non-urgent surgeries, and we'll have a reduced ability to care for patients both with and without COVID-19 in our communities. So that is my update on the epidemiology and the status of where we are in the pandemic. I did want to just give a few other quick updates. First of all, I wanted to give you an update on some of the recent data issues that we have reported to you all. First of all, back on November 21st, we did have to stop processing some of our negative COVID lab results. Due to our system not being able to process all the positive and the negative results that were coming in. I just wanted to report that we have been able to speed up the processing of our positive and negative lab results, and we do hope to resume reporting negative lab results on our dashboards on Friday. Another issue I wanted to give you an update on is that we have been having some issues with deduplicating some of our positive lab results because labs often will send us 4 positive results from the same patient on the same day, as there are small updates in the positive lab test that's being reported. We are working with our vendor of the system that does the deduplication. They are working on the code, the proprietary code in their system to speed up the ability to deduplicate. So just wanted to make sure that people understood that issue and knew that we are actively working on it. And then lastly, I just wanted to speak a little bit about the quarantine period and some of the changes that CDC announced this morning. So today, as most of you know, CDC announced some new options to reduce quarantine for people who have been exposed to COVID-19 cases. And I just want people to know that we here in Washington are planning to adopt the new guidance that CDC released today around the quarantine period. It will take us a day or two to update all of the documents on our website that have this. There are about 15 different documents that talk about the quarantine period on our website, and we're in the process of getting those updated. And just to reiterate from this morning, the CDC and the Department of Health do continue to recommend a 14-day quarantine period. However, the quarantine period can end after 10 days if the patient or if the contact does not have any symptoms. However, that individual needs to continue to monitor for symptoms for the full 14-day period. And then the other option is that to end the quarantine period around 7 days if the person who has been exposed remains asymptomatic and tests negative with about 48 hours before that quarantine period, within 48 hours of when the quarantine period ends. But again, that individual does need to continue to monitor for symptoms for 14 days, for the full 14-day period, and make sure that they isolate should they develop any symptoms. CDC has updated their website with this information. I encourage you to go look at it, and we will be adopting these options here in Washington as well.